Belly fat health dangers, visceral fat versus subcutaneous fat. Belly fat increases risks to health. There are two distinct types of fat, visceral and subcutaneous. The jiggly fat seen just beneath the skin is subcutaneous fat. The fat is apparent or can be pinned. In the spaces between the abdominal organs, visceral fat resides in a tissue apron which is called the omentum. This is not noticeable from the outside, unlike the subcutaneous fat. The subcutaneous fat. Subcutaneous fat is the fat just beneath your skin. This is the fat that is typically targeted when slimming down. If there is a lot of subcutaneous fat, there is likely to also be a lot of visceral fat. This can result in increased risk of health complications, including cardiovascular diseases, type 2 diabetes, and stroke. Causes of subcutaneous fat. 1. Fat mainly builds up due to consuming more calories than needed. 2. Low muscle mass. Muscle helps to burn fat. 3. Sedentary lifestyle. 4. Inadequate level of physical activity. Getting rid of subcutaneous fat. 1. Burn calories. This can be improved with a caloric deficit approach. Refer to previous video, Belly Fat Health Dangers, Burning Fat and Gaining Muscle, 2. Aerobics is a prescribed means of calorie burning and includes walking, running, cycling, swimming and other activities focused on movement which increase heart rate. 3. Weight resistance training. As well as burning calories, weight resistance training builds muscle, and muscle burns fat. The visceral fat. A type of body fat that is contained inside the abdominal cavity is visceral fat. This type of fat can be hidden from sight. It can also be unable to be felt from the body surface. The visceral type of fat is more likely to increase the risk of severe medical conditions. Health conditions such as heart disease, Alzheimer's, type 2 diabetes, stroke, and high cholesterol can be a greater risk when the fat level is higher. Causes of visceral fat. 1. Calorie consumption. Excess calories are stored as fat in the body. 2. Lack of physical activities. 3. Drinking alcohol can also add to increased belly fat. 4. Over the years, the muscle mass of women gets smaller and their fat increases, particularly after menopause. Getting rid of visceral fat. 1. Exercise is the best way to decrease visceral fat. 2. Changing eating habits to healthy choices and reducing the consumption of empty calories, high carbohydrate levels, processed foods, sugars and fatty foods. 3. Reducing sugary beverages, which can very quickly increase calorie levels. 4. Avoid tobacco. For more information visit our website, https://dailyhealthreport.org.